Hello and welcome to the latest Q&A with Asthma UK and the British Lung Foundation's in-house GP, Dr. Andy. Earlier this week, I caught up with Dr. Andy, where we discussed how to manage your asthma at this time of year, as well as guidance for those who have been newly diagnosed with a lung condition but are feeling unsupported. Plus, there's advice around prescription changes to inhalers. If you need any advice or any more information about anything discussed today, you'll find lots of useful links in the description below. And remember, if you find this video helpful, please do let us know by giving us a like, leaving your comments, or subscribing to our channel today. And if you feel able to, please do consider leaving a small donation to help us continue defending the nation's lungs.
We know that at this time of year, lots of people start to get colds, with mucus becoming an issue for some people with asthma. What advice would you give to people with asthma on how to manage their condition at this time of year?
I mean, that's a really great question, actually, and thank you to whoever sent that one in. So mucus is something that we all produce, and it's a very natural thing, and it helps us to protect our airways, our noses, and things like that from things that irritate or might harm us. We get more mucus when there's inflammation or irritation about, and that could be because of allergy, infections, pollution, smoking. And people with respiratory diseases might get mucus from their nose or sinuses or from their airways. And what I'd like everybody to do is take a visit to the Asthma UK website. I've got an entire page dedicated to mucus and tells you about different things about it, different changes and things that you can do to help it. So mucus from the nose and sinuses is the most common. And sometimes that can be because of the same process that's going on in the lungs, like the asthma, so due to an inflammation, infection or allergy, or it can be a completely separate thing. Either way, it can cause problems for people with airways diseases because it can dribble down the back of the throat, it can cause what we call a postnasal drip, and it can make people cough and have problems with their lungs. So some people who are getting problems with mucus from the nose and sinuses benefit from things like antihistamines, from nose sprays, and other people benefit from what we call nasal rinses or nasal douching. So definitely worth speaking to your pharmacist, your GP, or your respiratory team if you feel you're getting a lot of mucus from your nose or your sinuses. People with asthma, particularly who get more mucus coming from their chest, one thing they can do to help try and calm that down is by making sure they take their preventer medication regularly. And this helps to calm down the inflammation that causes the mucus. And it's important for everybody to keep an eye on whether their mucus is changing. We do notice that some people's mucus they get more mucus when there's more inflammation around or when there's a change in the seasons. Some people get thicker mucus, and by keeping well hydrated, you can help to reduce this. Mucus changes color, so it could be anything from clear to white to yellow. And if it's persistently green or brown, you might start thinking there's an infection there as well. And of course, if you're getting any blood in your mucus, make an urgent appointment to speak to your GP or one of your team, because this can be a sign of something more serious, although it might not be. So if you find that your mucus is changing, make sure you speak to a healthcare professional to get their advice. And if that mucus is causing you a lot of problems, again, there are things that can be done to try and help. So visit our website, keep in touch with your healthcare professional, and I say there's lots that we can do to try and help you keep that mucus under control.
We've been hearing from quite a few people who've been newly diagnosed with a lung condition who are feeling unsupported and feel like they don't have quite enough information. What advice could you give to people in this position?
You're right, Rebecca. I mean, as a GP, I'm hearing this, so people aren't getting the same length of time of appointments, or they're having remote consultations either with their GP surgery or at the hospital. And we're also hearing this through the helpline as well. And again, that's something that everybody can do. They can contact our helpline on the phone numbers that I hope you put on the screen afterwards, or by their WhatsApp contact that we've got as well. And that can be a good way of getting more information and support about your condition. So it's really important when somebody does have a diagnosis that they're getting good communication from their healthcare team about what that condition is and what the individual needs to do to help look after their condition, to stop it getting working, and what treatments are needed. If you are seeing your healthcare professional about respiratory problems and they're moving towards getting a diagnosis, ask them if there's any way where you can get more information about what they're looking for. And that way that you've got some preparation ready and you can think about questions and things that you want to know as well. And if you have had a series of appointments or take chance to sort of make a list of things you want to know. Are there places where you can get more information? Is that the NHS website, Asthma UK website, British Lung Foundation as well? And then start to jot down things that you might want to know. What happens next? Is there any follow-up? What do you need to do to look after your condition? What do you need to do to stay well? What do you do if things start deteriorating? Are there any things about your treatments that you need to know? Is there an action plan or some self-management plan that you need to help support you? But definitely worth trying to have those conversations with your healthcare professional. If that's not possible for any reason at all, you can often send emails or things like e-consults to your surgery to get a bit more information. And of course, there is the Asthma UK and then British Lung Foundation helpline as well. That they've got some superb specialist expert nurses who can. They've had years and years of practice working in the field of respiratory medicine and know about all the different conditions. So any queries at all, they're there and able to help.
And we've also been hearing from people who are worried about the lack of availability of diagnostic testing. So that's such as FeNO and Spirometry. Could you give us an update on how it's being used in GP surgeries at the moment?
So the whole NHS really reduced the amount of respiratory testing they were doing, and that's because of coronavirus, and COVID-19 is spread mainly through the lungs and the mouth and the nose. So it's really important that we keep patients safe, especially those who are more vulnerable, those who've got lung conditions, but also keeping the NHS safe as well. But both FeNO and spirometry are now recommended as safe tests in the NHS, but clinicians have been told they need to restart it, but only if the environment is safe. FeNO is easier. It's a breathing test which tests the amount of nitric oxide in the airways, and that's an inflammatory marker that we see in asthma. But this test is not felt to be a test that produces aerosols. So when people do it, they're not breathing out particles that can then increase the risk of spread of COVID. So that test can restart, and places can start to get their patients in for those tests now. Unfortunately, it's not that common a test in primary care at the moment, but hopefully we will see it more commonly available shortly. Spirometry is harder because it does involve taking a long, hard breath out, and that means that viruses and things can spread much more easily. The guidance that we've had is that it's a safe test to do, but as long as things such as hygiene and ventilation are all in place. And this is the ventilation particularly is something that GP surgeries are working hard to try and sort out so that we can restart spirometry and start getting people in for tests. Many people don't need these tests for monitoring. It's really important around the time of diagnosis. And certainly most practices, and mine included, are keeping a list of people who should have had the tests, and we'll get them in once we know it's safe and we're able to do it. The other time it's really important is if you referred up to the hospital, or if there's been a dramatic change in your lung condition, and then actually we need to recheck the diagnosis and how things are going. In that situation, we're more likely to do those tests, and it's really important to come forward and let your healthcare professionals know what's happening so that we can tell you whether we need to do those tests or whether we need to add you to a waiting list or whether there's some sort of alternative at this point. So I hope that answers the question. It's a difficult time for the NHS, and it's really important that we try and get these tests available for everybody and restarted again.
I'm just going to take a moment to say that all of our advice is correct at the time of filming. And please do check out the links in the description below for the latest updates from Asthma UK and the BLF on the vaccine. And of course, if you're enjoying our video, if you like what we're talking about, please do let us know by liking the video, leaving your comments, or subscribing to our channel. So Dr. Andy, another hot topic at the moment is prescription changes for inhalers. Could you talk us through some of the issues people might have around this and your advice?
Absolutely, and we've been seeing a little bit of this through the helpline recently, so people who are worried about inhalers that have been changed. So there's lots of reasons why some of these inhalers might be changed. So if somebody needs a stronger dose of medication, if they need a different drug to help control their condition, then that might involve a change. But sometimes it can be a little bit different. So the drugs aren't available, the inhaler's not available, those inhalers are no longer being made. Sometimes there might be cost reasons why part of the health system is trying to get people on slightly cheaper inhalers with the same drugs in, but it might look slightly differently. And actually more recently, we're seeing more places that are thinking about switching to more environmentally friendly inhalers. So as a GP who's interested in respiratory conditions, I'm very keen that we don't swap people when they're on an inhaler that is suiting and working for them. Because somebody who is on the right inhaler and it's controlling their disease is less likely to cost money because they're less likely to get flare-ups and end up in hospital or back in the GP surgery, and it's more likely to be environmentally friendly because they're not on multiple different drugs and not requiring lots of trips to the GP or the hospital. But sometimes these things are necessary, and it's really important that whoever's doing that change communicates well with patients. They need to explain why the change is happening, what's different about the treatment or the inhaler, are there some added benefits, and explaining why that change is being made, and making sure that ultimately the patient is able to take that new inhaler properly. And I think if you've been changed and you're happy with the inhaler and it's working for you, then that's absolutely great. Everybody sort of wins out of that. But if you find that after having your inhaler changed that your disease isn't as well controlled, or for some reason you're not so happy with the medication or the type of inhaler device, or you don't feel able to use it, then it's really important that you go back to the person who's changed it and ask them if there's an alternative or whether you can go back to your old version. It's really important that we keep in control of the disease that you've got, and that the inhaler is the best one that suits you and your condition. So the other thing to do, of course, is making sure that you visit the Asthma UK website, inhaler videos. And again, we'll put the link up at the end of on the screen so that you can sort of visit that and check that you're using inhaler as best as you can. But of course, if you're worried, if you've got any concerns, give our helpline a call or speak to your healthcare professional.
Still hearing from people worried about increasing numbers of people not wearing face coverings. Could you guide us through your advice on whether people should still be wearing face coverings, and what should people do if they're worried about others not wearing them?
So we know that wearing a face mask reduces risk to others and yourself of spreading infection, such as coronavirus. It's important that people know that wearing a mask over the mouth and the nose stops the spread of infection from the main source, which is the mouth and the nose and the airways. And government guidance is actually very clear. Even though it's not legally enforceable now, you are expected and recommended to continue to wear face coverings in places where the risk is higher. So this is generally sort of crowded places, enclosed spaces, and areas where you're coming in contact with people that you wouldn't normally meet. So I think the difficult thing is that people now have got their own choices here. It's not a legal thing. So we've got some people who are very keen to wear masks more often, but there's also people who are keen not to wear masks at all, as well as those who can't wear masks because they're exempted. So I think the important thing is do what you're comfortable doing. Don't feel obliged to not wear a mask because everybody around you isn't. You can avoid crowded and enclosed spaces a lot of the time, but if this is somewhere like work, speak to your employer about what can be done at work to try and get more people to wear masks or reduce the risk in some other way for you. And certainly it's really recommended by most of the companies that are providing public transport. They're all still encouraging most people to wear masks most of the time. So I think going along with that can hopefully reassure more people. And as long as people are sort of following that and are still doing the hand washing, getting vaccinated, and not spreading the disease when they've got symptoms, then it's really, really good at reducing the risk for everybody.
Thank you so much for watching today's Q&A with Dr. Andy, brought to you by Asthma UK and the British Lung Foundation. If you found what we've been discussing today useful, please do like the video, comment and subscribe to our channel. As mentioned, you can find lots of useful links in the description below. And if you feel able to, please do consider making a small donation today to help us continue defending the nation's lungs.